Oh. Hello, everyone, and thank you for joining us today. My name is Dr. Ashanti Carter, and I serve as the Chief Academic Liaison at Black Doctor. And I would like to welcome you to this installation of BD Live, and that stands for Black Doctor Live Stream. So, I want to take a little pause to welcome our sponsor, to thank our sponsor, Takeda Pharmaceuticals, for sponsoring this important conversation about psoriatic arthritis. So please note that this content is provided for educational purposes only and does not constitute professional advice. Use this information at your own discretion and risk. Okay, so with that being said, I'm joined by our esteemed panelists. So I'm going to start with Angel Akinbenyu, Director of Trial Equity and Representation at Takeda Pharmaceutical Company Limited. She's going to talk to us about all the great things that she does at Takeda. And then we're joined by Dr. Ashira Blazer, Assistant Professor of Medicine at the University of Maryland at the School of Medicine. And then last but certainly not least, we have Dr. Zoe Indigo, a board certified dermatologist. Welcome, everybody. Welcome, welcome, welcome. I want to start with, psoriatic arthritis. I want to start, by talking about psoriatic arthritis. Dr. Zoe, tell us a little bit about yourself, and then I want you to answer this question for me. Psoriatic arthritis, it's often understood, it's often misunderstood, but what can you, from a dermatologic view, tell us about psoriatic arthritis? Uh-oh. Wait a minute. Hold on.
Hi, I'm
There
Dr.
we go.
I'm Dr. Zoe Indigo. I'm a board certified dermatologist. I did my training at UCLA. So I am very qualified to talk about psoriatic arthritis and because I see it every day. What we know about psoriatic arthritis is it's a chronic inflammatory condition. It affects not only the skin, but our joints and our tendons. And I think what patients should know about psoriatic arthritis is that it can look really different. You know, your skin involvement doesn't necessarily give you the full answer, and that there is potentially even more joint involvement that could be underlying it. So there's lots that you should know about psoriatic arthritis, but for the sake of an introduction, let's start there.
All right. All right. So, Dr. Ashira, introduce yourself and then talk to us about some early warning signs some people might experience with psoriatic arthritis, especially if they already have psoriasis.
Absolutely, yes. So I am an academic rheumatologist at University of Maryland. Did a lot of my training in New York City at NYU and Hospital for Special Surgery, and so I've thought about autoimmunity and psoriatic arthritis for quite some time. Um, so I would say that, not all patients who have psoriasis develop psoriatic arthritis. So the majority don't. So about 70-80% of patients who have psoriasis, it's only limited to the skin. But a portion of people, 20 to 30% of people, do develop psoriatic arthritis, and it's more common in people who have certain psoriasis features. For example, if you notice that you have psoriasis on your fingers, or it affects your fingernails, so you have pitting or dents in your fingernails, you're more likely than other people to develop psoriatic arthritis. If you have it on your scalp, or you have more skin involvement, so wide skin involvement, you're more likely to develop psoriatic arthritis. So these are some of the warning signs. And patients will just start to say, "Hey, when I wake up in the morning, I have stiffness in my back, I have stiffness in my fingers," and that lasts maybe 30 minutes, an hour, 2 hours until I really get moving. And those could be early signs of psoriatic arthritis.
Wow. Thank you for that. Thank you, Dr. Blazer. So, Angel, introduce yourself and just tell us about the wonderful work that you're doing at Takeda.
Sure, thank you, and thanks for hosting this. So at Takeda, I lead the trial equity and representation team, and so really what that means in a nutshell is that my team is responsible for one, making sure or ensuring that the patient participation or patient enrollment in our trials actually matches the real world patient population with the disease. So what that means is we want to make sure that we're enrolling the patients who actually have the disease in real life. So that's one scope of my, or one part of the scope of my team. The other part is our conversations like we're having today. So we're talking about, or what I'm going to talk about, my part of the conversation is to talk about clinical trials. And so we talk a lot of just giving general clinical trial information, because obviously, yes, we want to progress the conversation and talk about clinical trials and the specific trials that Takeda has. But before we can do that, we need to lay the foundation, like what I call general clinical trial information 101 or clinical trials 101, really that foundation, that general clinical trial. What are the phases? Some of the terms you might have heard thrown out that you really don't know what they mean. We want to make sure that we address those. So we do that in a number of ways through different community engagement, different partnerships, venues like tonight, or mediums like tonight where we're having this conversation, to really just get that increase that awareness, which will then hopefully lead to increased access as well.
Absolutely. And that's very important. And to our viewers, you know what? You guys missed it, because remember, I said this is the second part. Yes, just as Angel stated, we actually did talk about clinical trials 101. So I suggest that you go back to part 1 and watch it. It was a great, great conversation. So let's get into it. Dr. Zoe, how does psoriatic arthritis, particularly psoriasis on the skin, present differently on skin of color, right, compared to lighter skin tones?
Definitely. I think in the dermatology textbooks, you see the definition or buzzword psoriasis is always described as these salmon colored pink patches or plaques. And in skin of color, our skin doesn't necessarily turn pink. It can be very hard to discern that brown can actually become more violaceous or purple in color. In terms of the scale, it can be less scaly and flaky, especially because a lot of skin of color, we are used to keeping our skin hydrated. So we can mask some of the signs of psoriasis just by over hydrating, over moisturizing, and even exfoliating. So that's why when I talk to my psoriasis patients, one of the things that our other panelists talked upon is, involvement not just on the skin. So scalp involvement, nail involvement. There can be pitting in the nails, like little tiny, almost dots in the nails. The scalp. It can be as clinically unalarming as aggressive dandruff. I've seen patients that have come in and said, "Oh, I've got really bad dandruff." That's psoriasis. So I think also too, psoriasis happens in stages. So sometimes, especially in skin of color, we're catching the post-inflammatory hyperpigmentation stage. So if there's not an active flare, maybe we're seeing the residual, dark spot. So I think overall, it's important to have an interest in treating skin of color. That's where it starts, but also have the experience. Oftentimes, that means training in a bigger city where you're going to get exposure to a multicultural, diverse population. But I think because of the disconcordance in the priorities, definitely psoriasis is underrecognized in skin of color.
Absolutely. And so you did say something that pricked my ears, and it goes along with the second question that I have for you. It's all about training, right? Training the next generation of physicians, especially those that specialize in dermatology. So why is it important that dermatologists are trained, especially, adequately trained in diagnosing psoriatic arthritis in patients with darker skin?
Well, it's important for us to have that training because it's prevalent. Psoriatic arthritis is a condition where we're racing against the clock. I mean, time is literally joint, is what I tell my patients. So
Mm.
it's important because, you know, in our skin, especially, for one, our skin is very resilient. You know, we have increased fibroblasts, increased melanocytes that help us to heal. So oftentimes it can be a delay in the diagnosis. The other thing is psoriasis can look like a lot of things. Psoriasis can look like eczema, it can look like a fungal infection, it can look like skin cancer, you know, cutaneous T-cell lymphomas. So, you know, any board certified dermatologist is going to have it on the differential, but I think it's important to lean in and not to assume, oh, it's just eczema. Oh, it's probably just a contact dermatitis. You really got to get into it and you really got to unpack the history and ask the right questions. So, you know, I have a special interest in psoriasis, or there are specific questions that I'm looking for. You know, I'm asking about heel pain. I'm asking about not only heel pain, but does your ankle hurt in the morning? You know, patients, I was trained that patients don't read textbooks. So you really got to clinically put your questions into the patient's life experience. Do you
Mhm.
have heel pain? No, I don't have any heel pain. When you wake up in the morning, does your feet hurt a little? Well, actually, now that you mention it, doc, you know, that is such a very common interaction in my office. So just
Wow.
making sure that you have that invested interest and the time to spend with patients is super important to just really unpack and get into the history.
I love that. I love that, Dr. Zoe. Dr. Blazer, I want to bring you into this conversation because Dr. Zoe, she touched on something where she said psoriatic arthritis, it can look like different things. So once psoriatic arthritis actually progresses from the skin to the joint, what are the potential consequences if it goes untreated?
Yeah, I think Dr. Zoe said many very pertinent things, but one of them is that time is skin, but also time is also joint, right? So psoriatic arthritis is painful for patients, and that's what they really worry about. And of course, we all want to be comfortable, but the thing we have to remember is that when it's not treated, you can actually get damage to your joints. So it's one of these kinds of arthritis that can cause erosions in the bones. It can cause thinning of the cartilage, right? And so this over time can lead to disability when we don't treat it with medications that stop the inflammation and damage in its course. Um, the other thing is, this is a problem with inflammation all throughout the body. So, when you have a systemic inflammatory problem,
Mhm.
you're more likely to go on to have other chronic illnesses than other people. So, people who have untreated psoriatic arthritis
Mhm.
are at higher risk for heart attacks and strokes, right? They're at higher risk for vascular disease. So, we really want to make sure those patients bring down that inflammation to protect their
Wow.
joints and the rest of their bodies.
Wow. So that's really just whole body health.
Yes.
Wow. Wow. I didn't know that. Wow.
Yes.
Thank you for that, Jewel. So, in your experience, Dr. Blazer, what are some common misconceptions about psoriatic arthritis that you counter and you've encountered in patients of color?
Yes, I think the biggest one is that it doesn't happen in patients of color,
Mm.
and also it doesn't happen in women, right?
Mhm.
There is a big misconception that this is a disease of white men, and that is not true. As Dr. Zoe was saying, we haven't diagnosed it well in people of color and in skin of color for quite a long time, but also in women, right? This is something that does happen in women, and women may express their pain differently than men. So some of the classic symptoms that we think of with psoriatic arthritis, you wake up in the morning, you have that kind of back pain that
Mhm.
is stiff and you have a hard time bending over, you're not as flexible anymore. Those are things that men complain of. But
Okay.
women may complain of different things, right? Women may
Mhm.
have, more pain in their joints. They may have pain in that heel, that pain when you first wake up in the morning, the few steps out of bed. We call that plantar fasciitis. That happens more in women. And so, because physicians aren't attuned at looking at skin of color and saying this is what psoriasis looks like, or
Mhm.
asking about pain and saying this is what pain in women looks like, or even believing women when they report pain, we
Mm.
miss. And that means that these patients aren't being treated up front the way that they should be.
Okay, so you hit on something, and I want to ask the both of you this because it's something that Dr. Zoe alluded to earlier. So this question is for both of you, Dr. Zoe and Dr. Ashira. So what are some questions that physicians, dermatologists, rheumatologists should be asking their patients of color to make sure that nothing is missed, right? So looking at language, looking at getting to the root so you can have that interview, right? That informational interview to get as much data from the patients as possible. I'm going to start with you, Dr. Zoe.
Well, the first and easiest thing I think that we have the opportunity is on our physical exam, because the skin will tell you what's going on. So always checking nails. And I know that especially in women of color, we have our nails did. So, making sure we ask, when is there anything underneath that nail, just to start making sure that the patient can be aware. I would say heel pain in the morning. That's my number one. Every patient gets asked that. Any swelling, unknown swelling. Have you ever had any sort of fingers swell up randomly? And sometimes I'll get, no, but my mom has that. So that helps me start thinking, okay, it's giving family history. I won't steal them all because I'm sure Dr. Blazer has the whole score. There's a score system actually, Dr. Blazer.
Yeah.
You can speak to.
Okay. All right. Dr. Ashira, jump in.
Yes, for sure. Yeah. So there is a scoring system. But as we said before, patients don't read the textbook. So one thing that I tend to ask is, what could you do before that you can't do now? And that really uncovers a lot of things, right? Because somebody may, feel pain differently or have pain in different, but if they say, I used to be able to open bottles and now I can't, I have to ask my husband to open the bottles, right? Or, I used to be able to get out of bed and get going, take a walk in the morning. Now I have to wait for a couple hours. And by the way, I'm taking ibuprofen every day, right?
Wow.
Those kinds of things clue me into potential inflammatory arthritis. And then I can start asking that checklist, right? So it's not just pain in the joints, it's pain, we call it enthesitis, but basically, essentially what this is where the muscles attach to the bone, there's like a little ligament. And in that area, you can actually get some inflammation. So that heel pain that we're talking about the first time you wake up in the morning, that is a place where the muscles of the underfoot meet the heel and you can get that inflammation. Or even the Achilles, right? So where your calf meets the base of the heel, that's a common place for people to get that tenderness. People will say, I used to play golf or tennis and now I have pain in my elbow. That's also enthesitis. That's where the muscles of the forearm meet the elbow and you can get inflammation there, right? So those are things that we ask for. And we also ask, do you find that you're having to take ibuprofen, Motrin, Aleve, Advil every single day to get by, right? If you find that that's happening, this may be a response to an anti-inflammatory, an over-the-counter anti-inflammatory that suggests that you're self-managing some inflammation.
Wow.
And if I can, patients are always downplaying their pain, especially when they're in my office, because we're going to talk about skin. We'll get into some of these questions, Dr. Blazer. I'm sure you can agree. It's like, do you have any shoulder pain? Well, I kind of always had that. Your answer is yes. Yes, you
Right.
have some shoulder pain.
Right.
So I encourage patients to, you're doing only a disservice to yourself by downplaying your symptoms. And, the more we downplay them, at the end of the day, that's time. And you don't want to wait until your symptoms are slapping you in the face and limiting, your activity to address them. That can be
Right.
That is so important. And I will say, so because especially for people of color, right? We are used to carrying the world on our shoulders. We are used to being hyper independent and we are used to being the one who has to get it done or else it doesn't get done. And so when we start to complain about pain, we feel like we're saying, actually, I can't do it. Actually, I can't have the world on my shoulders. Actually, and that is something that is stigmatized in some of our communities, but also something that we feel bad about ourselves, right? So what I try to tell my patients is you're not complaining, right? You're not saying that I have a weakness or a deficit. You're helping me put the pieces of the puzzle together. So even if you have pain that you feel like you can tolerate, you need to tell me when something is different than your usual so that I can understand what's going on and help you feel the best you can possibly feel.
Absolutely. And it's about being on the team of you, right? I call that when you talked about having the world on your shoulders. It's just like the Wonder Woman syndrome, right?
Mhm.
So I call myself Wonder Woman, but it's like, you know what? Sometimes she needs the Justice League behind her. She just can't do it all, right? So that's, I think, as we as people, you know, not just women, but as people, we understand that it's okay to ask for help. So this is all good stuff, but I want to flip it now, right? Let me flip it. What about the patient? They're telling you, you know, they're telling you, Dr. Zoe, you know what? Yeah, I feel concerned about my skin. I'm getting these weird plaques on my skin. I've never had that before. Or, you know, Dr. Blazer, they're just saying, oh, my fingers are stiff. So you have these patients that are doing their best to advocate for themselves, but they aren't being heard, right?
Mhm.
So what can they do? And you know what? I'm going to be open. This actually happened to my husband not too long ago who has psoriasis. And he was just, you know, oh, I don't like that cream. That doesn't help me. And now with my plaques, they're beginning to bleed. It's causing me pain. Can you give me, you know, something else? And he just wasn't being heard. So, Dr. Zoe, then Dr. Blazer, what can patients do?
I think naming it helps. You know, ask leaning into your doctor and say, well, could this be psoriatic arthritis? You know, that's going to help and that's going to make your doctor think about it. You know, if it's not
Mhm.
on their differential, which it should be, it at least is bringing your concern and they need to document your concern. And you know, medical visits, they're legal interactions, you know. So don't be afraid to remind your doctor of that point if you feel like you're not being heard. I would say, you know, it's so tough because I just feel like I'm so thorough in my office, but
Yes, you are.
I, at the end of the day, you can always get a second opinion,
That's
and
right.
make sure you have someone who is listening and supporting. And I think too, use the commercials if you don't feel confident enough, or if you can't name it. Oh, I saw this drug on a commercial. Can you tell me about what my other options are other than creams? Lean on the resources that you do have access to. Oftentimes, especially in dermatologist visits, you're booked. I see some practices, they book people with 10-minute visits, and it's not enough time to really unpack and get into it. So making sure that, you follow up and say, okay, if that's all the time you have for me today, then I'd like to make an appointment with you next week or two so we can continue this conversation, because you deserve more time, especially when you have an inflammatory condition. I book all my patients, my in-person visits are 30 minutes. Okay.
Nice.
That's what I give to my patients. Am I making as much money as a dermatologist across the street? No, but we are getting into it, and we are unpacking not only the condition, because that alone can be really heavy to understand, but all of the options, all of the different options: oral, biologic, topical, all the things. So,
I
in
love
general.
it. Yep, I love it. Dr. Blazer, how about you? How
Yeah, I think those are a lot of great suggestions, and actually the time is a big one, right? And I am the kind of I take a lot of time, I talk a lot. So then I just had a baby, and like when I go to the pediatrician, I book 2 appointments. I'm like, I need 2 appointments back to back because we gonna talk, okay? Like, you're not rushing me out of here. You're talking to my child. We just book 2, right? So, that's something that you could possibly do. But I also think, your doctor is one spoke in the web
Mhm,
of resources you have for your health,
mhm.
right? So, that in-person conversation is a part of it, but also make sure you have a robust a support system with informed family members, informed friends, and also join a national society or a local group. Okay.
Mhm.
That's going to do a couple things for you. One, it gives you support for other people who experience what you experience. One thing with autoimmunity is people will say, oh, you don't look sick, but you feel bad, but nobody understands that you look sick. And that can be a really big frustration. So just interacting, having community with other people who are going through it makes a big difference. They'll also talk about things that are going with them. This happened to me and I took XYZ and that worked, or this didn't work for this reason. So you'll get to understand the different treatment modalities. And then if you're a part of a national organization that puts out good information, you will have an understanding of the scope of possible treatments that are available to you. So then if you're saying, hey, I'm taking this cream, it's not helping, is there anything else for me? And your doctor's saying no, there is something else for you. Right? So then you can come with some suggestions, So those things can be really helpful for self-advocacy.
I love it. I love it. And so, Dr. Zoe, you and Dr. Blazer, you guys have been tag teaming, right? And I love it. I love it. So, looking at psoriatic arthritis, how can dermatologists and rheumatologists, how can you work together to provide better coordinated care?
Yeah.
And can you explain how it's done?
So in my office, I am very aware about the medical system. I especially have patients who come to me because under their insurance or whoever is in network with their plan, they can't get an appointment for 6 months. So in my visits, if there is a suggestion of psoriatic arthritis, I get my patients teed up. So I'm getting the blood work. I'm getting the blood work in case, not only to measure if there's any sort of inflammation and to help the rheumatologist, but also in case we want to pull the trigger on some of the heavy hitter medications, let's make sure you're a candidate for these medications. And even I literally had a possible psoriatic arthritis patient last week. I ordered the x-ray. It's not, it's something that I can do. I did an internal medicine intern year, as all dermatologists do. We don't just forget the internal medicine part. So I'm able to order the x-ray and I'm able to get everything teed up and then I always encourage the patient to start trying to see the rheumatologist. Because Dr. Blazer, I know you're booked and busy. What is your wait time right now?
Okay, so it's long, but in my defense, I do mostly research and I specialize in lupus actually. So I specialize in like African American women with lupus, and so I just have I'm like so I have like a small window of clinic time.
Answer: it's a long wait. So
okay. It's a long. I'm sorry.
The more that I can tee up so that when you are plugged in with Dr. Blazer or another rheumatologist, you're getting that information and they're ready to meet you in a place that's even more able to be more sophisticated than a first-time meeting. And the other thing I do is education. So not everybody knows what a rheumatologist is. I often find myself explaining the difference between a rheumatologist and an orthopedic surgeon or a podiatrist. So, just making sure that is a part of my counseling.
Wow. Okay. What about you, Dr. Blazer? How is it that a rheumatologist would work with someone like Dr. Zoe, a board certified dermatologist?
Yeah. So first I try to know dermatologists, right? So so you're the DMV area or where? No, you're in California. That's the worst. Okay. So I need to learn the like scope of dermatologists in my area, right? So, I was in New York for a very long time. I'd moved here to get married and also to start the Lupus Center at Maryland. So like a year and a half ago. So I'm still trying to build up my network of other providers. But I am within a health system where there are dermatologists. So, knowing dermatologists in that way, if somebody says, hey, I have this patient, they have this new diagnosis, it's going to be really important for them to see you early, I can say, all right, I don't mind double booking this slot or like keeping my clinic open a little longer to make sure that that person comes in, right? So those like personal interactions are huge for making sure that patients get the care that they need. The other is I love that Dr. Zoe does the X-ray and does the blood work for me and all of that.
Yeah.
Like that, like
That's
really
amazing.
ESR,
it's huge
ANA.
because, you know, the first time I talk to a patient, I'm going to need the blood work. I'm going to need the X-rays, right? So if we've already had that workup done, my next conversation can be, what are we going to do for you? And that is really, really, really important.
That.
Yeah. And then just making connections and doing joint education and letting patients know you really need to see both of us for this.
I love that. And I like that you said joint education. I know what you meant, but it was kind of funny.
It's so on brand.
Yeah, I love that. Just working hand in hand. And it goes back to the lines of the whole body, whole health, right? And so when you talked, Dr. Blazer, about looking for dermatologists, that's also a tool that anybody can look using a Black Doctor. So we actually have a database. You can, find a dermatologist, a rheumatologist in your area, using, what insurance you have, and it's right there. So you're not in that. You're not in it by yourself. You're not in it by yourself. And that's the importance of having these conversations. And that's why I'm so thankful that Takeda Pharmaceutical, they actually said, hey, this is something that we want to talk about. So speaking of Takeda, all right, Dr. Angel, you've been
you promoted me. Okay.
Yeah, so that's prophetic. That's prophetic.
I receive it.
Yeah, that's prophetic. So, Angel, you've been waiting patiently. And we heard Dr. Blazer say, oh, yeah, I do research and all of the things. So, Angel, talk to us about clinical trials. Why is participation in clinical trials so important when it comes to diseases like psoriatic arthritis?
Sure. I'm definitely going to answer that. But before I do, I've been listening patiently, and both of you, Dr. Indigo and Dr. Blazer, have just been saying amazing things. I'm actually stealing that. What did you say? Patients don't read the textbook.
Yeah.
I'm stealing that because I think it's important, even in the clinical research space. It's applicable for us too, and for our work, which is why we really tried to break it down again into that general clinical trial 101. And I also really love what you said. I think it was you, Dr. Indigo, about, or Dr. Zoe, about how you need to, patients come to you and you're a dermatologist. So when you start asking questions about other body parts, they may not answer. And I think that's just so important how, when you're talking to your doctor, whatever doctor, talk about everything, because as a patient, you don't have that background and that understanding to know how things kind of work together. So I just thank you for sharing that. But in answer to your question, Dr. Ashanti, about clinical research, it's so important for in general, but particularly in diseases like psoriatic arthritis, because one, they are under studied in our communities and communities of color. And as Dr. Indigo and Dr. Blazer have shared, it presents differently on and in Black or darker complected people. Mm-hmm. And so when we think about clinical trials, and we think about, is this medicine that we're studying, is it safe? Is it effective? We need to think about it for all people. So thinking about efficacy, for instance, if we think about in terms of removing a rash or removing, the irritation in the scalp, that's going to look different. So if we say that it works on a white patient, for instance, based off of their, skin complexion, how do we know that it's actually effective in a Black patient if we're not studying it in a Black patient? Yep. So we need to make sure. And then just biologically, the way, our bodies metabolize drugs is different. So we need to understand that from a dosing perspective. We need to understand it from an efficacy perspective. Is it effective? Is it actually working? And also from a safety perspective, when we think about side effects and risks, because those can vary based off of genetics as well. So we need to make sure that we have all the patients, the different types of patients, the different communities of patients who could potentially use this drug if it's approved. We need to make sure that they're part of the research so that we can have that data, so we can again, all of this data can be evaluated and interpreted to determine whether or not the drug is safe and effective.
Right. That generalizability, right?
Exactly,
Yep.
exactly.
Absolutely. So, Angel, I have another question for you. We know this historically, people of color, we've been underrepresented in clinical trials. I think the stat, it's 3% of participants in clinical trials are Black, right? So how does this impact treatment outcomes for our communities?
So again, it goes back to, when this data, is then, and excuse me, when this data is then shared with the FDA or whatever regulatory agency has to ultimately approve it before it comes to market. So in a clinical trial or clinical research, all of this is being studied, and then all of this data, all of the patient data, all the findings, everything, all the tests, everything has to go to the regulatory agency in a particular country, and then they make a determination of whether or not it's actually going to be approved, whether or not it's actually going to be available for prescribing. And so when we as in the Black community or communities of color are not part of clinical research, then our data is not included. So if this drug then proceeds to go on and is approved, we don't have the data to say whether or not it actually worked for us. So, now, we're taking a medicine, whether it's orally, topically, whatever, we're using a medication that really hasn't been studied in people, people who are similar to us. So we don't know, is it going to be effective? We don't know if it's going to be safe. And so this does affect treatment because we're in a way kind of wasting time. We're using a drug that may or may not work for us. And again, you obviously, that's a risk with any drug. Everyone's body is different. But knowing that, this particular medication has been studied in, people like who look like you, who have similar, biologic backgrounds to you, it helps to validate the data more. So it's really important that we are part of the research, that our data is counted in that research, so that, again, for that generalizability that you spoke about a minute ago.
Right. So basically, hashtag our participation matters, right?
Oh, it's crucial.
Yeah. Hashtag our data matters, right?
Hmm.
Okay. Okay. I love it. I love it. So let's talk about Takeda and the great work that you're doing. So what steps are being taken to ensure more inclusive representation in dermatology and rheumatology trials?
So for us specifically at Takeda, and this is even applicable in, I'm starting to see this more in the industry as a whole, we're trying to be intentional about raising awareness.
Mm,
Again, like so many dermatologic, diseases and like psoriasis and things like that,
mhm.
they could look, people don't know, they could be this, they could be that. And so you start to, a lot of people try to diagnose themselves on WebMD, and now I've started to, I'm guilty. I've started to diagnose myself chat GPT. I'm a chat GPT doctor. Um, and so when you do that,
Angel.
when you put in your symptoms and when you start to type in your symptoms, it's going to come back with a whole gamut of things.
Right.
And so you really don't know, you really don't know. And so we want to raise that awareness. And some of these diseases like psoriasis, like psoriatic arthritis, they're not diseases that we talk about in our community. These aren't like the top diseases that, oh, my grandma had this or my auntie had this. These aren't diseases that we really know about. And so if we don't know about them, and then we're going to, unfortunately, a lot of times we're going to physicians who may not know, it's not even that they don't know about it, they just don't recognize it in people who look like us, then we're missing out. So we have to make sure that we're bringing that awareness so that people can be educated. You spoke earlier about, advocating for yourself. That advocacy can only come from having, that information, from being educated, from having that awareness. And so, at Takeda, we take a lot of time to talk about disease information. Again, I told you, we already laid the foundation with clinical trial information, but then we layer that with disease information. And we want to talk about diseases, again, that are not just prevalent in a particular community, but diseases, again, that impact communities that you may not necessarily, typically think about. And then as far as educating doctors, and I think both doctors spoke about this, certain diseases present differently on different skin. And so, we've made sure that we're, providing pictures, even things like pictures of what it looks like on different skin, providing that education to doctors, and particularly doctors who may not be treating or may not be as used to treating a more diverse, patient population. So it really, to me, I would say it really comes down to like that education and awareness. But the responsibility or that education awareness is not just for the patients, but it's also for the providers as well.
Oh man, Angel, you just hit so many points just about the training, how important it is for that. The
Mhm.
pictures, right? The images. That's super important because with derm, it's about sight and a little bit about the touch, right, Dr. Zoe?
Oh, absolutely.
Yeah, yeah. Yeah, so it's really important what you talked about, Angel, and I love this. So, just with clinical trials for those patients of color who may be hesitant, what would you say to encourage them to consider participating in clinical research?
So I would first say talk to your doctor.
Mhm,
Definitely have the conversation with your doctor. Again, it goes back to being that advocate for yourself.
mhm.
What we, there's a lot of old data, there's a lot of old thinking that, particularly in our community, that we are not participating in clinical research because of Tuskegee and other
Mm,
actual things that have happened in our community. And
mhm,
and there is, and yes, that actually does exist. That school of thoughts is still there. That
mhm,
pain is still there. But
mhm.
there's actually a lot of data that shows we're not participating because we're not asked or because we don't have the awareness.
Right.
And so, I think that educating, again, so you can go talk to your doctor, so you can be an advocate for yourself. That's one of the ways. That's one of the ways. Ask me your question again.
No,
I just lost
no,
my
no.
train of thought.
You answered it. You said I mean, for patients of color who may be hesitant about participating in a
Yes.
clinical trial, like what would
Hmm.
you say to encourage them? Yeah, to
And
consider.
so, and I think going along with that education, so it's, again, talking to your doctor, but then also educating yourself. And one of the ways, and one of the things that I think that is so important with the education piece, and thank you for refreshing my memory, getting
Mhm.
old. One of the things I think that's important when you think about that is there are so many safety steps that have been put in place since the days of Tuskegee. But
Uh-huh.
again, if we're not having this conversation, if we're not educating, patients, then they don't know. So they don't know all of the safeguards that are in place. And there are so many. There's, in the US, for instance, there's something called an IRB. So it's an institutional review board, and they're made up of independent people who are doctors and even independent community people whose job it is to look at the protocol of a particular study. They're the ones who are looking at materials. They're really digging into the trial. Pharma companies have to submit all of this information to them, and they're digging in to make sure that it's safe. Like, that is their job. They have no bias. Their job is to make sure you're safe. And then even the physicians, so the PIs or the principal investigators that you will work with, or the principal investigator who's actually leading the study at a site, their job is to make sure you're safe. So at the beginning, they're going to go through all of the safety risks for you. They provide contact information for you, 24-hour contact information, so that if anything comes up, anything, even things that you think may not be, oh, I have a headache, and you think, oh, this may not be related to what's going on with this disease or with the study, they want to know about this. So there
Right.
are all of these safeguards in place to make sure, to make sure that you're safe, and to make sure that, we are really and truly moving beyond the place of using people as guinea pigs. That is not where we are anymore at all.
That's
And
right.
again, there's so many safeguards, so many protections in place to make sure that's not the case. So I would say really educate yourself, and then also have the conversation with your doctor. And with any doctor, again, whether you're going to a specialist like a dermatologist or rheumatologist, or even your, primary care doctor, if this is something you're interested in, if you just want to know more about it, ask the question, advocate for yourself for sure. And then
Absolutely.
and then I was just going to say another great way to find out about clinical trials, if you're interested, in learning more, is clinicaltrials.gov. So that's a government-run website. It lists all the clinical trials that any pharma company is doing, and even independent investigator run trials, and it's global. So you, wherever you are in the world, wherever you are in the country, you can do filter. You can filter it by where you are, and you can find clinical trials that match your criteria. And then I am going to put a plug in for Takeda's patient registry, WeConnect, and the URL is weconnectpatients.com. And so what I think is really awesome about the registry is, one, you can register, so you can put in your information. You can spell out and talk about what your interests are. And then it gives us permission this does not mean you're signed up for a trial by any means. There is no obligation at this point at all. You are not registered. It just means that we are allowed to contact you and say, hey, Dr. Ashanti, you gave us your information and you said you're interested in these particular areas. Here are some trials, here are some clinical studies that match your interests. And you can, click to find out more information if you're interested. So that's one avenue for WeConnect. And then the second avenue is, it's another great resource for, again, that clinical trials 101. So there is a ton of information and videos and FAQs on there where you can dig in and find out, again, all the things you ever wanted to know, maybe things you didn't even want to know about clinical research. Everything is there. So it's really a great resource, and I encourage you to go to it.
Yeah, I mean, and since we're on the topic of WeConnect, come on, Angel, talk to us a little bit about WeConnect a little bit more. So why is it, and why is it beneficial to the patient to have personalized matches for trials, that might fit their condition, and how does WeConnect connect them to that?
So what I would say the biggest difference between like a clinicaltrials.gov and a WeConnect is, with clinicaltrials.gov, you have to really go in there and dig. And it's not, if I'm being honest, it's not the most user-friendly site. Again, you can definitely get what you need, but you have to dig a little bit more. You have to really, really filter and kind of work through that site. WeConnect Patients is made to be patient-friendly and user-friendly. So again, we're not asking you to go find, the clinical trials. We are just asking you to put in some information, some basic information, some of your interests, what are your health issues or health concerns, things like that, things that you'd be interested in learning more about from a clinical research perspective. And we do the work. So then we come back to you again. This gives us permission to send you an email, to contact you and say, hey, Dr. Ashanti, you said that you're in LA and here's some and you're interested in dermatology trials. Here are some trials that you might be interested in. And then if you're interested, then we provide that link that you can click on to learn more and start to go through the process of, one, learning more. And then, again, if you want to continue, if you want to proceed, seeing if you're eligible to participate in the trial. So it really just takes the burden off the patient. And that's really what we were trying to do with WeConnect, is make this as easy as possible. It shouldn't be hard to find health information, particularly if you're suffering with a disease, you already have enough on your plate. Like, having to dig through and try to find, treatment options is the last thing you want to do. So we want to make it as easy for patients as possible. And again, with even the second part, or the second kind of purpose of the website, getting that clinical trial information. Yes, could you Google it? Could you do all these searches? Could you go to a library and see if they still have encyclopedias and find out this information? You could go digging for it, but why? It's right here. And again, it's so robust. It's things, again, that you wouldn't even think about, and helps to, that education, that awareness really helps you when you do want to talk to your doctor about clinical trials, because now you're coming in armed with some information. So now you can have an even more informed and educated conversation with your doctor. Again, just empowering you to be an advocate for yourself.
Absolutely. And to our viewers, we see the WeConnectPatients.com image on your screen. There's a QR code. And so what happens when they scan that QR code, Angel?
So when you scan the QR code, it's going to take you to the homepage. And again, there's, depending on what you're there for, if you're there to register, which we hope you are, then there's a link where you can register and put in your information. It's not a long questionnaire. We're not looking for you to put in your whole life and medical history, but just enough to get started so that we can then, again, share study opportunities with you. And then again, there's also multiple tabs and videos if you want to just get more general clinical trial information. So that QR code is going to take you to the homepage, and then you can navigate from there based off of what you're interested in and learning more about.
I love it. I love it. So let's just stay here. Let's stay here. And thank you for that. So let's get back to us. We can remove that image and get back to us talking. So Angel, one more question. And then I think I want Dr. Zoe and Dr. Blazer to chime in. But answer this for me, Angel. Can you
Mhm.
explain the importance of, doctors having timely access to the clinical trials and 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 the correlation that the correlation to the patient having new possibilities of their health needs. So just talk, let me take a step back because I stumbled a little bit. So just explain the importance that the doctors have timely access to the trials and the correlation to patient having new possibilities for their health needs.
So I think from a HCB perspective or from a doctor perspective, the importance is it gives you there's more treatment options.
Mhm.
So, I think historically, so many people, patients and physicians have thought of clinical trials as a last resort. Like we have exhausted all of our options. Now, there's nothing else left to try. Let's do this clinical trial. And it really doesn't have to be a last resort. It really, I think we're shifting to a different place, a different mindset, both from a physician standpoint and from a patient standpoint, where we know that clinical trials are a treatment option, can be a treatment option from the beginning. And
Wow.
so, and physicians recognizing that, then, again, it really, I guess, it's incumbent upon them. It's really on them at this point to make sure that they start to offer clinical trials and start to, even if they don't run clinical trials, have a conversation about clinical trials with their patients. And one thing I would say, and this is why I think it's so important, again, that education and awareness, and this, it's important to not be biased in these conversations. So,
Mm,
physicians, when they're having these conversations, we can't make judgments about, oh, well, I know she's really busy, so she's not going to be in the clinical trial, or oh, I know, like, she works shift work, so it's not going to work. Ask everyone, give them the opportunity. So I think from a physician standpoint, that's really important. And I will put in one more plug for We Connect. There's actually a physician tab on there. So it's not, so obviously it's primarily for patients. We connect patients, but there's also a place for HCPs. And so they can also put in, if they're interested in, they're being interested in research themselves or interested in even referring. So, HCPs, it's We Connect Patients is for you as well. But going back to your question from a patient standpoint, again, it goes back to the treatments. The more research, the more that people are involved in clinical research, the more medications that are being studied, the more options you have. You think back to, and I'm sure people who've been around for a while can think back to maybe, for certain diseases, there might have only been, and I'm sure Dr. Indigo and Dr. Blazer can attest to this, maybe just a couple of treatments. And then
yep.
fast forward maybe 10 years, now we have, 10, 20 different treatments. And that's important because, as I said earlier, every medication, every treatment doesn't work for every person. So having more options means that we're that much closer, or you're that much closer to finding something that's actually going to work for you. But it all starts with clinical research. Every
Yep.
medication, every medication, every treatment, regardless of what it is, even something as, generic and general and common day as Tylenol, started off with a clinical treatment. So as we think about those treatment options and it becoming such a part of our lives, we have to think back to the fact that it started with clinical research, and it starts with people willing to participate in the research.
I love it. I love it. Dr. Zoe?
You're gonna have to feed me the question again. I'm not
Okay,
gonna.
no. It's okay. It's okay. So, can you explain the importance of physicians like yourself having timely access to trials and the correlation to patients having new possibilities for their health needs?
Yeah, I definitely think it's important to have that access and to have, especially when we think of clinical trials, we often think of the doctors who've been practicing for decades. They're expanding their practice and looking into clinical trials, but it's often some of the younger docs who we still have our finger on the pulse, and we've searched PubMed, we're fresh out of residency, and we know how to speak to patients about biologics because we've got an arsenal of tools in our toolbox, and we're looking for new and innovative ways. So, I think that is where the priority should be in terms of educating the next generation of physicians and, teaching them about the importance of clinical trials because, in medical school, we're taught what there is today. But if we're going to be the doctors leading tomorrow, we have to have the opportunity to learn what clinical trials look like and so that we can speak to them, to our patients, and, having that patient interaction and the support of your physician makes transitioning to clinical trials much less scary as an idea.
I
Right.
love
Much
that. I
less
love
scary.
that.
Oh,
Mhm.
yes, much less scary. All right, Dr. Blazer, come on.
Yeah. So, I mean, I like my other hat is research. So I love this conversation. There are so many places where I wanted to be like, I'm going to chime in here. But I will say participation is really important. And it's not that, response to therapies fall along racial lines or, presentations fall along racial lines. It's that the more diversity we have in the trials, the more we understand how these drugs work in many, many, many different scenarios, right? So, not just how they work, how they're metabolized in different people, but also how these people are responding, how they may say this is a response or not a response, right? Cultural differences in uptake of medications, right? There's so much information that we can learn about how to treat our patients when different groups of people participate in clinical trials. So it's really important. And then the other piece of it that I think gets lost is people who can't access healthcare can't access clinical trials. So that means when you're a part of a clinical trial, there is an infrastructure that helps you access healthcare, right? Someone is calling you to make sure that you're going to your appointments. There may be stipends to make sure that you have transportation. There may be options for childcare, right? So, all of these things that the trialists use to balance the burdens and benefits of participation in trials actually may help you access healthcare. So one thing that's really, a blessing for the patients, but sometimes gets frustrating for people who do trials is that even people who are in the placebo group, meaning they're not getting the medication, tend to do better than they were doing before they participated in the trial, right? Why is that? Well, because there's an infrastructure around clinical trials that helps care uptake in a way that people don't have when they're not participating. So it actually is a scenario where you get certain benefits, certain communities, certain knowledge and know-how just by participating. So it can actually be something that is helpful for patients whether or not they get the active medication.
Right. And also in clinical trials, I mean, the PIs, these are folks who are scientists. They are providing you with great care, so it isn't what a person would think, which is something negative where, like Angel stated, oh, well, they're just using me as a guinea pig. No, these are bright minds who are really interested in keeping you safe, and they want to make sure that we're getting the results. Like, you're doing great. So I love your answer, Dr. Blazer, which you stated. So I think that's great. So you guys, what? This has been like a great conversation, but I have one more question. And this will be I think this is a great closing question. And it's for all three of you. Okay. So we talked about research, right? So the benefits of all of that. We've talked about psoriatic arthritis. So let's do this. How does joining the HCP Collaborative Care Network foster broader collaboration amongst these physicians committed to advancing patient care? So why would you do it? And there's a reason why I'm asking. So of course, with Angel, she talked about We Connect, but I'm going to put a plug in for Black doctors upcoming our private physician PI training program. So we are actually training physicians who are in private practice to be principal investigators. So as I told you before, just looking at just the stats of folks who actually participate in clinical trials, right? It's only 3% are Black. So if I'm a patient and I see that my PI is Dr. Zoe, I'm more likely to participate. So how does joining an HCP collaborative care network foster broader collaboration, right? How would that happen, Dr. Zoe?
That is a great question. We've got like 30 seconds left to answer it. So my one word answer would be it's the future. Patients are getting smarter. We're using ChatGPT. Patients want what's cutting edge, and the FDA can't keep up. I mean, I know that there are certain medications that work not only in the skin, but for hair loss, but they're not on label yet. So clinical trials will help bridge that gap and get patients access faster.
Okay, Dr. Blazer.
I would say it's the trust, right? So we always talk about mistrust in clinical trials, but the first part about being trusted is being trustworthy, right? And healthcare professionals have not always been trustworthy, if we're honest, right? So I think when we are able to build community such that patients who have a trusted physicians can get information about these trials, we build the first block in order to help foster that trust in our communities and then participation.
I love it. Bring us home, Angel.
And I would say awareness. I think in the communities, again, it's the sharing of information. And so it's the sharing of information amongst your network, but then you're able to then take that information and then share it for the benefit of patients. So I think it's awareness.
I love it. So we're at time. I would like to thank our esteemed panelists, Angel Akavinyu, Dr. Ashira Blazer, and Dr. Zoe Indigo for this beautiful, beautiful conversation around psoriatic arthritis. And of course, I have to thank our sponsors, Takeda Pharmaceuticals. So until next time, stay healthy. Bye, everybody.
Bye.
Bye. Thank you.
Thank you.